society by giving of their time, their energy, their talent, and their treasure. At this particular time, when we are dealing worldwide with the COVID-19 pandemic, frontline workers, doctors, nurses, healthcare professionals, those who work as in EMTs and others come to mind. The police, law enforcement, essential workers come to mind as at this particular time in history, they are working to curb the transmission of the COVID-19, to flatten the curve. And so therefore, at this particular time, as we celebrate International Workers' Day, these people stand out. Those on the front line, essential workers, and so on. And we have to commend them and support them in the work that they are doing. Today we have quite a number of presentations. The transmission of the COVID-19 to flatten the curve. And so therefore, at this particular time, as we celebrate International Workers' Day, these people stand out. Those on the front line, essential workers, and so on. And we have to commend them and support them in the work that they are doing. Today we have quite a number of presentations from our Medical Chief of Staff, Dr. Wilkinson, Mr. Carlton Phillip, who is Director of the Department of Statistics, Mr. Anthony Eveling from the St. Kitts Nevis Building Contractors Association, Superintendent Henry, our CMO, Dr. Laws, and Mr. Samuel. I would like to start the ball off by inviting Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the Joseph N. France General Hospital, to give us a presentation entitled "The Journey of One of Our Early Index Cases, Ending Stigma and Discrimination." Dr. Wilkinson.
Thank you, Lesroy. This pandemic has brought out the best in us. It has also exposed a side of us that is in serious need of correction. A colleague of mine of 22 years was one of the early index cases of COVID-19. When she shared her ordeal with me, I thought it was important to document her journey on paper for her, and so I did. She would have loved to be here today to relate her ordeal in person, but couldn't. Part of the journey was also already prematurely released on social media. She has asked me to come and share with you, the public, her experience with the hope that it will make us all better and united in the fight against COVID-19. And here is a story. My name is Bernadette Jack, and I have been a nurse for 39 years. During those years, I cared for many patients with many illnesses and always tried to show empathy, trying to understand the suffering of my patients. It was my belief that if you do good, then good will follow you. I therefore thought that if I became ill, the same empathy would have been extended to me. Being relatively healthy and full of life, the thought of illness was, however, the last thing on my mind. My life was, however, turned upside down in March this year when I was diagnosed with COVID-19. What I experienced, I would not like another human being to go through, which is why I decided to put a face to the name that was dragged through the mud by so many. I am not looking for sympathy nor empathy because the time for that is past. What I am asking is that no one be treated the way I was, by the general public, and that we all use my experience to be stronger and better and be our brother's keeper in the time of need. Like most of you, I heard about the outbreak of coronavirus epidemic in Wuhan, China in late December. I remember Dr. Wilkinson giving the first lecture to the staff at the Joseph M. France Hospital in early January this year and speaking about our preparedness. I never in my wildest dreams thought I would have had to prepare myself mentally and physically to fight this disease personally. I traveled to New York on March 12th and returned to the Federation on March 18th. I was perfectly fine without any symptoms, but self-isolated because of my knowledge of the disease and my history of travel. On the 20th of March, I was tested for COVID-19. I was pretty certain that this was out of an abundance of caution and the result would be negative. My heart almost stopped when I received the report saying that it was positive. This was at a time when all we were hearing were the thousands of persons dying daily in Europe and North America. It sounded like a death sentence. As I isolated at home, I waited every day for the fever, cough, or shortness of breath to come, but the symptoms never did. What happened instead was the unearthing of a side of humanity I would like to see buried forever in our Federation. From the day it was announced that a 57-year-old female with a recent history of travel was diagnosed with COVID-19, I was hunted down. My family was identified and pictures of us were placed on social media. My name and that of my family was dragged to the mud. I felt at times that I had committed a serious crime. The mental torture I thought I would have gladly exchanged for the physical suffering of the disease. I thank the Almighty God that He kept me healthy through it all, and that I did not have to deal with both, that is, the symptoms and the mental torture. There were threats made to my family and I. There were even threats to burn my house down. As my family and I remained isolated in our home to prevent the disease from spreading to others, I sometimes wondered if that same home would become my coffin. I woke up many times in the middle of the night looking to see if my house was set afire. I never knew if these threats to our lives would materialize. For 6 weeks, I remained isolated. I could only venture out to my porch or my backyard, and even then, I felt unsafe because of the staring eyes. You never really miss the basic things in life until you don't have them. Not being able to go to work, go to the grocery store, or the hairdresser to have my hair done made my days very long and my nights even longer. I will be forever thankful to Almighty God for giving me the strength to go through this ordeal and providing some good Samaritans along the way to help me. To my brother-in-law, who came every day to see what we needed, I say a big thank you. To my husband, who was a rock of support during this turbulent period, I say thank you. To my priest, other family members, and circle of friends who communicated with me virtually and provided me the emotional strength and support to push on every day in the midst of adversity, I say thank you. To all those who dragged my name in the mud and threatened me and my family, I say I forgive you. I was declared COVID-free on April 23rd. I look forward to returning to my normal life with the new norms. There are others who have been diagnosed and are going through now what I experienced. There are others yet undiagnosed who I would not like to see go through the mental torture that I experienced. Let us educate ourselves about this disease. Let us continue to contain the spread and support those who are affected. Let us end stigma and discrimination and move forward as a nation. Lastly, I want to thank the Ministry of Health for the work they have been doing to fight this disease. I was very happy that the contacts I had were successfully identified and all found to be negative. Let us continue to use the tools we have to fight, that is, identify, isolate, quarantine, hand hygiene, social distancing, and mask. I am ready to rejoin the war against this virus and look forward to re-entering the workforce of the Ministry of Health and to work alongside the Chief Medical Officer, Hazel Laws, my Medical Chief of Staff, Dr. Cameron Wilkinson, and other colleagues to defeat COVID-19. And as I said before, let's stamp out stigma and discrimination. I thank you. Bernadette Jack.
Thank you, Dr. Wilkinson. Such a powerful testimony coming from Nurse Jack. I would now invite Mr. Carlton Phipps, Director of the Department of Statistics, to address us in relation to the Poverty Alleviation Program. Mr. Phipps.
Pleasant good afternoon to everyone. As was indicated, my name is Carlton Phipps. I'm Director of Statistics in the Ministry of Sustainable Development. And today I'm here to present on the Poverty Alleviation Program that is being operated by the Ministry of Sustainable Development. Now, the Poverty Alleviation Program is a social assistance program of the Ministry of Sustainable Development that was launched in December of 2018. The PAP, as we call it, and some people affectionately call it the $500 program, aims to assist the poor and the needy and the most vulnerable households among us. Herein, households earning under $3,000 could apply and receive consideration of a monthly stipend of $500. Now, with the confirmation of COVID-19 cases in St. Kitts Nevis and the likely ripple effect on the people of our Federation, the Ministry, under the leadership of the Prime Minister, Honorable Prime Minister, and our Permanent Secretary, Ms. Elrita Simpson-Brown, moved to expand this PAP initiative that we've been running since 2018. Herein, an additional $5 million was added to the budget to support persons affected by COVID-19. This new initiative aimed to offer temporary support to persons who were laid off from their jobs, receiving reduced hours/pay from their jobs, or their business closed entirely because of the COVID-19 pandemic. Now, within the office, in order to reduce the risk of the contracting or the spreading of the virus, there are several protocols that we put in place in order to be able to move this process forward in terms of being able to help persons while at the same time taking the necessary precautions. For one, we put online the application form at our website, www.stats.gov.kn. We also launched a public awareness campaign online using Facebook and other media to get the word out that our application form is now online. We also limited the number of persons allowed in the office. One person, not more than one person at a time. We also provided contact information so that persons willing to complete the form or have queries about the process of completing the form, that they could do so by contacting us via our telephone numbers. Within these, this is just a few precautions that we have taken. Also in our office, that we would have reduced our staff, practicing proper social distances, with about 50% of the staff operating, working on this process. If I could give a few statistics based on the information that we have put together so far. And this is based on data that we have compiled up to Friday of last week. So far we have had, as of Friday last week, we had 685 applications processed. 59% were female applicants as against 41% males. Thanks. If we look at it across industries, based on what we've completed so far, the largest sector, 30%, is from the hotel sector. Other significant sectors include the retail sector, particularly those stores that are on Port Zante, those sort of tourism-related businesses. Transportation, the taxi and tour operators, personal services and manufacturing has been some of the key areas that were from the forms that we have received so far. In terms of approval, of the 685 applications that we have processed so far, 72% of those were approved for payment. 9% received conditional approval. Conditional approval meaning that they provided partial data, perhaps a letter from the employer indicated that they were laid off, or completed the form and indicated that they worked probably at a hotel, and we knew that most of the hotels are closed. So we gave them a conditional approval on the basis that once they provided us with the additional information that we can complete the application process, that these could move to final approval. Those in the not approval category, for the most part, these were others who either submitted partially completed forms or additional information that we required to make a definite decision that was not available. So these are persons that we're reaching out to sort out those ones. Thanks. Now, eligibility to the PAP program, as we call it. Persons who were given reduced hours pay without supplementary support. Persons who were laid off from their jobs. Persons who were made redundant. That means that their position was officially terminated. Persons who cannot do business because their market has disappeared. For example, we know that the tour taxi operators, the craft vendors, the ships not coming, the planes not coming, that these persons are not able to ply their trade. Also, the category of persons who, based on the close contact nature of their services, that they are unable also to really apply their trade. Next. Now, there's a category of persons that we indicate need not to apply. Why we say that? Persons already receiving social assistance from the Department of Social Services. They're already receiving some benefits from government. Persons who are on reduced hours and payment, but we know Social Security and Labor Department in collaboration is offering assistance through the COVID-19 Relief Fund, that persons applying to this program and receiving that support, that they would not also apply to the PAP program, recognizing the fact that, I will put it that, the idea in the Ministry offering assistance is that we want to be able to provide some level of comfort and support to households, but not to the extent that we're putting persons in a position better than what they were before. This is about support, not putting you over the top. The other category, persons whose income well over $3,000 and were not significantly impacted by the COVID-19 pandemic. Now, how to apply? As I indicated earlier, that the application form is on our website. Visit our website, stats.gov.kn. As you go to that website, there will be a pop-up ad, Poverty Alleviation Program. You click on the ad and you read through the explanatory notes, which we have there. And to the bottom of that section, you then see download application form. You complete the form, you save it, and then you return it to us via our email, which is statistics, the full word statistics, @gov.kn. We have had several cases where persons have been trying to complete the form on their phone and failing to save the form before they send it back to us. The form is coming back to us blank. So reminding persons to ensure that the information, after inputting the information in the form, that you ensure that you save the form before you try to email it to the department. Now, in addition to the application form, there are some additional documents that are required. Number one, a letter from the employer indicating that the applicant is receiving reduced hours or was laid off from the job or is made redundant because of the COVID-19 pandemic. We also need a copy of the person's recent payslip, a copy of an official ID. It could be your social security, driver's license, voter ID, passport, proof of address, which is a bill, or some other, for example, in the voter's ID, I know that particular one has the person's address in it. But for the most part, we've been using a bill with the person's name and address. Proof of nationality, where you're petition or you're of another country, that you provide us with some proof of your nationality. And if you're a non-national, that you would provide us a copy of your residency status. Now, some of the major issues that we have noticed from the applications that we've been receiving so far. Number one, partially completed form. So the applicants would complete the first section perhaps with the personal information, the name, date of birth, gender, address, etc. But when it comes to the employment section, that is left blank. Some people will say English is a funny language. One of the questions that we have in the questionnaire is number of persons in the household employed. And I guess for some, well, I'm not working at this time, so they put 0 or they put nothing. But really, what we're looking for is up to the point of the onset of cases in St. Kitts Nevis, what was your position, the number of persons up to then who were working. We do recognize, once you fill in the details in the employment section, that perhaps say you were working at a particular hotel, and we know that is closed, so we know that you're not working right now. Other issue we have is that person put in the unemployed, but this is not clear to us whether you've been unemployed before the crisis or thereafter. No contact information provided. In some cases, we have to follow up with persons either to get their banking details or get some other documents that is needed. If there's no contact information, we are unable to get in touch with you. Applicants submitting the same information several times, as these emails are coming through our email. These forms are coming through our email. Now, it has been a challenge in terms of the number of applications that we're receiving. I could say on average, we receive about 100 applications per day. And if we have to take the time to respond to each one, yes, we receive, it would really take away a lot of time from the whole processing of the application. So what we have been doing is, as we go through the applications, if there is missing information, then we would contact the person and have them submit the necessary information that we are requesting. So we apologize, bear with us, but we cannot respond to every email that we receive. We are trying our best to move the process along, and that persons who are in need of the money and are qualified to receive those funds receive them at the soonest possible time. Another one is the insistence of persons bringing the form and other documents to the office. We have put up several notices on the office asking that persons would, as much as possible, use the email for submitting the information. We do understand, yes, that some persons do not have access to the necessary technology, so they have no choice. But for every person that brings in a form to the office, there is a risk of bringing the virus along with you. if we have a case being brought to the office, someone is affected, it means that the whole office potentially can be affected, which means that we probably would have to close down operation for a little while for everyone to get tested and for the office to be disinfected or sanitized. So we are encouraging persons as much as possible. If it is not necessary for you to come to the office, as it is, you have other options to submit the information through our emails, please do so. Alternatively, we also have been taking persons' contact information so we can call you and complete the form. Yes, the additional information that we would have to discuss with you in terms of how we can get those. Last but not least, persons applying to the regular PAP must complete the form in its entirety. So the application form, as I said, persons who are laid off, they are complete just the initial section which refer to themselves alone. But persons who are completing the form because they wish to apply to the program because their household income generally fall below the $3,000. You have to complete all sections of the form, which include providing information on the additional members of the household who are working. Next slide. Last but not least, we posted this flyer recently, which, as you say, it's also on our office, that would encourage persons to sign up online. Our website, stats.gov.kn, our email address, statistics@gov.kn, our telephone numbers, 467-1257 or 662-3597. Thank you.
Thank you, Mr. Eveling, for that comprehensive presentation. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report.
Thank you, Mr. Williams, and pleasant good afternoon, all. This afternoon, I will begin my presentation with the arrest statistics, and as usual, I'm always pleased when I have to report that we haven't made any arrests over the past 24 hours. It means that we are getting greater compliance, greater cooperation, and we always encourage this. However, today the total arrests remains at 101 for the Federation. Today is the last day of limited operation days for this week. The night curfew will begin from 7:01 p.m. this evening until 5:59 a.m. tomorrow. Then for the next 3 days, starting at 6 a.m. on Saturday 2nd until 5:59 a.m. on Tuesday 5th May, there will be a 24-hour curfew in place, a total lockdown. Regulation 8 of the COVID-19 regulations will therefore be in effect. This particular regulation requires every person shall remain confined to their place of residence, inclusive of their yard space, to avoid contact outside of their family, except essential workers who are required to report for duty, staff of hospitals and medical facilities, or essential travel for medical emergencies. And of course, the Commissioner has provided exemptions for persons who are caregivers. If you have to provide care for elderly or persons who cannot care for themselves, or if you are a farmer, you are permitted limited time on these days to attend to these particular business. We just ask that you inform the police or the police station nearest to where you are living before you proceed on that journey. All business establishments shall remain closed except for the following businesses, which may remain open: hospitals and medical facilities, businesses licensed to operate as security guard services, and businesses or undertakings specifically exempted by the Commissioner of Police. So during this 3-day period of lockdown, all business establishments shall remain closed except for hospitals and medical facilities, security guard services, and businesses or undertakings specifically exempted in writing by the Commissioner of Police. All works of construction shall cease except where it is necessary for the purposes of health, safety, and security, for urgent plumbing, electrical, roof repairs, for urgent plumbing, electrical, roof repairs, and other emergency repairs for a home or business. And of course, if you are exempted by the Commissioner of Police in writing. The Commissioner of Police wishes to thank the vast majority of residents for their cooperation to date and their compliance with the regulations, and asks that you do your part by encouraging those around you who you see may be in violation to become compliant and to report violations when you see them. Thank you.
Thank you, Superintendent Henry. I now invite Mr. Anthony Eveling from the St. Kitts and Nevis Building Contractors Association to address us. Mr. Eveling.
Thank you, Mr. Williams. Good afternoon, everyone, listening by radio, television, or a virtual platform at home and abroad. I'm grateful to Mr. Samuel for the opportunity to present this special COVID-19 announcement to the construction workers on behalf of the St. Kitts and Nevis Building Contractors Association. Fellow builders, contractors, and subcontractors operating within the construction industry of St. Kitts and Nevis, we are fully aware that construction is a serious business. It must be done by trained persons with the knowledge, the skills, and the experience of the various skill areas. One of the general requirements of the industry is to obey the rules and regulations for health and safety at all times. This is absolutely important in saving lives. As the Federation Health Professionals, technical workers, and others continue to fight the war on COVID-19, let us also do our part in winning the battle by doing the following. Let us obey the life-saving regulations given under the emergency laws by practicing good health and safety at all times. Cement dust, concrete dust, and masonry dust will cause you to sneeze. Wear your mask. Sawdust, sanding dust, and earth dust will cause you to sneeze also. Wear your mask. Practice social distancing. Stay 6 feet apart from each other when on the job site. Do not eat in groups during tea breaks and lunchtime. Stay 6 feet apart. Protect your eyes. Wear your goggles. It is very important. Wear your goggles. Protect your hands. Wear your gloves when necessary. Protect your feet. Wear protective footwear, proper shoes, No draggers, no flip-flop. Protect your body. Wear proper clothing. Avoid loose clothing. This can be a hazard. Avoid the use of tools of other workers. If you have to, sanitize your hands after the usage. When traveling to the work site, avoid sitting in groups. Remember to wear your mask. Do not leave the job site in your working clothes. Work safely at all times. Protect yourselves and others. The life you save might well be your own. I quote, "The purpose of human life is to serve and to show compassion and the will to help others as we battle COVID-19. Stay safe, everyone." This message is from the St. Kitts Nevis Building Contractors Association. I thank you.
Thank you, Mr. Eveling. Your illustrations were particularly helpful. I now invite Dr. Hazel Laws, our Chief Medical Officer, to give her report. Dr. Laws.
Thank you, Mr. Williams, and good afternoon to everyone. As of today, Friday, May 1st, 2020, at 3 p.m., the World Health Organization reports 3,175,207 confirmed COVID-19 cases globally, with almost 205,000 deaths. To date, 294 persons have been sampled here in the Federation of St. Kitts and Nevis. Their samples have been tested with 15 confirmed positive, 273 confirmed negative, and 6 results pending. This afternoon, I want to confirm that 8 of the confirmed cases have recovered. I repeat, 8 of the confirmed cases have recovered. To date, we have 0 deaths. Currently, 56 persons are quarantined in a government facility, while 55 persons are quarantined at home. 7 persons remain in isolation, while 688 persons have been released from quarantine. Now I want to provide a notice to food handlers. Clients whose food handler's permit have expired within the last calendar year, having acquired the requisite training last year, you are kindly requested to submit the following to facilitate renewal. You must submit 1, a valid medical certificate, 2, the expired food handler's permit, or 2 passport-size photographs, 3, the renewal fee of $20 XCD. All clients will be interviewed to ensure compliance with food safety regulations. Clients whose permit have expired over 1 year ago, or clients requiring a new food handler's permit, you are required to present the following: 1, 2 passport-size photographs, 2, the expired permit if applicable, and 3, a valid medical certificate. Such clients will be required to attend a food handler's clinic upon appointment given at registration. Please note, in an effort to adhere to the new physical distancing protocols, only 15 persons will be permitted to attend food handler's clinic at any given time. The Environmental Health Department anticipates your fullest cooperation and looks forward to facilitating your request until we return to a state of normalcy. Be reminded that each of us have our part to play in protecting others and ourselves from this disease. Continue to engage in physical distancing measures by ensuring at least 6 feet between persons, engage in effective hand washing practices, sanitizing your hands regularly, and finally, wear face cloth masks in public spaces. Maintaining the overall health of the people of St. Kitts and Nevis continues to be our individual and collective responsibility. I want to remind us that our national statistics and other COVID-19 related information can be found at the official website www.covid19.gov.kn, the St. Kitts Health Promotion Unit Facebook page, and the St. Kitts Health Promotion Unit YouTube channel and Instagram. I thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
Thank you, Mr. Williams. Good afternoon, all. Those who are tuning via internet, watching via television, and listening via radio. And also to our colleagues and friends from Caribbean Broadcast Network in the BVI. I want to acknowledge my sister in the BVI, Victoria Samuel, and my niece Nadia Samuel Douglas, who is also listening. I want to begin with a number of acknowledgements this afternoon. In particular, this one coming with compliments from Sensational in the Shoreline, who wishes to thank you all for your hard work and dedication in the battle against COVID-19. Please accept this donation of 5,000 EC dollars as our contribution towards the effort. May your every endeavor be crowned with great success, and may God bless each and every one of you for your willingness to serve and your fortitude in the fight to keep us all safe. Toast to the staff, management, and ownership of Sensational and Shoreline Plaza. Thank you from the Federation of St. Kitts and Nevis. And one of the tables here today, we have a cake and some apple cider. And this apple cider came for a number of persons who celebrated birthday in the month of April. And according to the note from the famous Newtown fisherman, it states that these gifts are for the belated birthday. In particular, Dr. Hazel Laws, Chief Medical Officer, Dr. Cameron Wilkinson, Medical Chief of Staff, Mr. Lesroy Williams, and Superintendent Mr. Cromwell Henry. And also to the Prime Minister, the Honorable Dr. Timothy Harris, and the Minister of State with responsibility for health, Ms. Wendy Phipps. Keep up the good work that you are doing for this wonderful country. Thank you for the donation of 2 cases of carnation milk for the children home. For the past 2 days, Spice Mill has been supporting the NEOC by providing hot meals on both days. And I personally, this is personally from me, I want to acknowledge with that great and joyful heart Miss Denise at Domino's Pizza. She decided today to become a stronger, patriotic citizen by providing the students at the government quarantine facility with pizza and drinks to help them enjoy their time in quarantine. Dennis, a heartfelt thank you from me and also from the parents, and most of all, from all of our students. They enjoy their time. I also want to acknowledge a private citizen, corporate citizen that is, who donated $1,500. This donation was well accepted. And also, I want to highlight from the Permanent Secretary within the Ministry of Health, Dr. Stapleton Harris, Dolores Stapleton Harris, who forwarded this information to me. And this comes from the Citizen by Investment Unit. Dear Dr. Laws, the Citizens by Investment Unit, together with Respect Immigration Service of Dubai, would like to donate a total of 4,000 medical masks to the fight against COVID-19. The efforts of you and your team are commendable for the tireless and unselfish commitment to the country's effort in this battle, and we thank you. In addition, on behalf of Galaxy Real Estate, I am including 4 protective overalls and 5 goggles to be used by your staff as appropriate. Again, thank you to you and your team. So I have acknowledged all the commendations, and I now wish to inform you of the work by the various task force. May I begin with the Compliance Task Force. Today, the Compliance Task Force would have visited 43 businesses and engaged 11 passenger buses. I am informed that one of the passenger buses was extremely non-compliant and not cooperative. This is not good. Again, the Compliance Task Force continues to see the non-compliance of the bars who are still engaging in selling alcohol. I want to now take this opportunity to inform all the business owners and bars that come next week, Tuesday morning, we will no longer be engaging in education. We will no longer be engaging in evaluation. We will be engaging in enforcing the law. Today, this afternoon, before I came on the show, the press briefing, I engaged the executive of the chamber. I also engaged the president of the chamber in particular, and had a long discussion with her. And she has agreed and pledges her support that the full extent of the law has to be laid upon these businesses that are non-compliant. It's in the best interest of public safety. We have made some significant gains, and these gains must not be lost due to ignorance. Let me just inform you of the hard work from this task force. This task force, from the 20th of April to the 1st of May, has assessed 551 businesses. 551 businesses. And approximately 45% of those businesses are not compliant with Regulation 15 of 2020, Section 7 and 6 in particular. I am making this last appeal to you to put the necessary measures in place and avoid being shut down. We are going to shut you down in the interest of public safety, and if necessary, we are going to take you to court. Your business will be shut down until that court date is granted. We also have engaged the Attorney General Chambers, and we have asked them to look at making some of these offenses ticketable, and failure to pay the ticket, then we take it to court as well to be fined or otherwise. So please, I'm making this last appeal to you, business places, to comply. The Buses Association will be engaged again through the Ministry of Transport once and for all. We will no longer jeopardize this. So therefore, as of next week, we will begin enforcement. I want to thank you very much for listening, and also I look forward for everyone compliance with the upcoming full lockdown days. As of tomorrow, you will be seeing Ms. Vesta Southwell reporting on behalf of the National Disaster Coordinator, so that I can get a break, and also she will at times chair this briefing so that Mr. Leslie Williams as well can also get a break. He needs it, trust you me, he needs a little break. As he said to me last night, Mr. Samuel, I need a break too, okay? So we will also give him a break. So thank you, and we look forward to your questions.
We've now come to the question and answer segment. The first two questions are for our Chief Medical Officer, Dr. Laws. Dr. Laws, please explain the relationship between pending results and the number of persons quarantined. I don't believe immigration contributes to that figure, since our borders have been closed since March 25th. Further, I thought all trace contacts were tested, and if so, the number of pending results should be close to the quarantined. Please enlighten me. The second question, if I understand it, you said over 150 persons tested so far in the Federation have been contacts of confirmed cases. What other categories of persons have been tested? Dr. Laws.
We are thankful for these two questions. Now I'll begin answering the first question by saying or describing or explaining what pending results mean. Pending results is a term that indicates that samples have not yet been completely processed. In other words, the samples have been taken, sent to the two labs that we are using, and the results are not back as yet. The samples have not been processed as yet. Now, to date, 294 persons have been tested. 273 lab reports have returned negative. 15 lab reports returned positive. And at present, we have 6 results pending. So now let me address or explain the relationship, if there is any, between pending results and persons in quarantine. Now today we have 55 persons quarantined at home. These persons are mainly contacts of confirmed cases who we traced, sampled, and tested already. And so their numbers and the results have already been tabulated and accounted for. 56 persons are presently quarantined in a government facility. Yesterday we were told that, or we announced that 51 students were repatriated from Jamaica to St. Kitts and Nevis. This took place yesterday. Our borders remain closed. These persons, they have not yet been sampled or tested. Your other question, Mr. Williams? Okay.
If I understand it, you said over 150 persons tested. So which one answered?
Okay, so, all right, so we have tested suspected cases, meaning there are two categories of persons that are being tested. We test suspected cases. These are persons who show up with COVID-19 symptoms or respiratory-related symptoms. These persons meet the WHO case definition. We have also sampled and tested contacts of confirmed cases. Some of these had symptoms, some were symptom-free. Yesterday, in the situation report, I would have explained that there were approximately 193 such contacts of confirmed cases. So these are the two categories of persons that we are testing. And please note that this approach is in keeping with international protocols and guidelines. Thank you.
Thank you, Dr. Laws, for your response. This question is for Mr. Phipps. What if you have received the Social Security assistance, but your salary is still below $3,000? Can you still apply for the poverty alleviation program?
Good evening again. Short answer, yes, you can apply. However, as I explained earlier, that the category of persons applying for the general PAP, meaning that the household income is under $3,000, these we're dealing with, but our priority of this time are the persons who were laid off, who were made redundant, who cannot do business. These are what we're operating as priority right now. So we have those applications and we'll be dealing with them as time goes along. Thank you.
Thank you, Mr. Phipps. This question is for Superintendent Henry. Why are the drain cleaners in Irish Town and downtown Bastia being ordered to go back home whenever they come out early in the mornings to clean the drains? They are essential workers and should be permitted to do so. Superintendent Henry.
I'm not certain if that is accurate, but I would have to investigate. Yes, I do agree that these persons are considered essential. They are part of the health environment, and so they should be permitted to function during the time that they wish to. So I would investigate, and if that is so, we would have it stopped.
This one is for Dr. Wilkinson. Who is exempt from wearing masks? And if the police sees somebody wearing mask, not wearing a mask, and they explain that they're asthmatic or they have breathing problems or something like that, how should this be dealt with? Dr. Wilkinson.
Generally speaking, when someone is in public, it's advisable that we all wear masks to prevent us spreading the disease. There are some categories of persons, though, that should be taken into special consideration. It is thought that if a child is below the age of 2 years old, then that child may not have to wear a mask. However, it doesn't necessarily mean that we're saying that that child is free to move around in a supermarket, in a drugstore, etc. It means then that the parents need to exercise responsibility and keep that child away from the general public. Also, persons who would not be able to remove the mask if they were having a problem, because if you have a mask on and let's say you are going to vomit, you don't want to have the mask impeding your area and then you start choking. So if it's somebody who is quadriplegic, who is unable to remove the mask themselves, then these are persons who should not be wearing a mask. But it also means too that these are persons who during this pandemic should not be out in the general public. Okay, and so by me giving those categories is not a free pass for persons to be up and down without mask. If you know that you are in one of those categories, then you need to make sure that you stay home, you stay out of the general public. We are asking persons to sacrifice a little during this time so we can have an entire lifetime ahead of us, and that's all we're asking. Well, even if somebody is asthmatic, they should wear a mask also, because these persons with pre-existing conditions, they are at increased risk for the ill effects of COVID-19. And so just because you're asthmatic doesn't necessarily mean that you cannot wear a mask. We have persons who are asthmatic who work in the operating theater for years and who spend the entire day with mask on. And so just because you're asthmatic does not necessarily mean that you should not wear a mask. As a matter of fact, if you're asthmatic and you're walking around with a mask, you are protected from inhaling dust particles, etc., that would trigger your asthma attack. And so just by you having a diagnosis of asthma is not an excuse for you not to wear a mask. As a matter of fact, it would protect you from certain inhalants that would trigger an asthmatic attack.
I would like to add, if you're asthmatic and if you put on a face mask and you're uncomfortable in any way and it's hampering your breathing, it may mean that your asthma is not controlled. And in fact, you really need to see your physician. You need to take your medication such that your asthma will be under control. Thank you.
This question relates to the poverty alleviation program. Can the PAP team explore the possibility of acknowledging receipts of all applications? This can be achieved through an automated email text messaging service. This is very important in order to alleviate the anxiety of applicants.
Again, thank you for your question. I do take that suggestion on board, and I will discuss with my colleagues how we can put that in place as soon as possible. Thank you.
This question is for one of the doctors in the room. Can recovered persons return to work knowing that they are no longer infected with the virus?
Yes, and that is the whole reason why persons are considered recovered, because we have an extensive program to determine that someone is recovered. Once they're symptom-free, we observe them for 14 days, and then they have 2 samples on separate days, and if these 2 samples are negative, then it means that they would have cleared the virus, and so these persons are free to return to the workplace and to normal activity. And that's one of the reasons why I read the testimony from one of our index cases, because what we are still having here fear is stigma and discrimination. And because someone knew that someone had COVID-19, they think that this is a label that is supposed to stick with them for the rest of their lives, and that is not so. And so if somebody is declared recovered, this person is free to go to the supermarket, they're free to go to the hairdressers, they're free to return to work, and there should be no reason to stop them. Now, just one other thing I want to say on the mask, because sometimes I look at Facebook to see some of the questions that persons ask, etc. And I've been seeing complaints about the fact that, some poor persons can't afford to purchase a mask. Now, we have masks that are made in different price ranges. And we also have different levels of masks. Now, we've said from very early that the N95 masks and those types of masks, those are for healthcare workers. But for you going out in the general public, you can start off with an ordinary cloth face mask. And what we're basically saying is that every single citizen, basically across the globe, should be able to find something to put on their face to prevent themselves from spreading respiratory droplets. And so you can start with a simple cloth face mask, and if your budget allows, you can move upwards. However, I've seen a lot of persons who have been walking around in N95 type mask and speaking about the difficulty with breathing. And this is because these are not masks that are made for you to be wearing 24/7 walking around town. Okay? And so although it is the best mask in terms of filtering out microorganisms, it is not the mask to be walking around town. And so you can start off with a simple face mask, or you can get some of these regular surgical masks that are being sold in a number of businesses. I thank you.
Okay, this question has to do with monitoring and compliance. The team participates in visits daily to stores and buses to make sure everyone complies. Who monitors the ferries?
As you can see, the process is going progressively. The ferries, for what we have been made aware, due to the fact that we have the SCASPA security and other more controlled setting, they keep reporting to the NEOC and inform us that they are complying with the regulations. The task force will also visit those areas. Our main focus is in particular public transport, which yes includes the ferry, but the biggest challenge we have, because it does not have a strong control setting, is the buses and the businesses which are patronized a lot by our citizens and residents. With that said, the control setting of SCASPA keeps us informed and notified of the compliance by the ferries.
Okay. Yes, so someone wants to know if they're jogging on the bypass, if they have to wear a mask. If they're jogging all alone, if they have to wear a mask. Superintendent.
Again, I repeat the purpose of wearing a face mask at this time. The purpose is really, if you are an asymptomatic carrier, it prevents you spreading viral-laden droplets to other persons who may be close by. So having said that, if you are jogging on the bypass all alone and there aren't any persons nearby, feel free. You can jog without wearing a face mask. However, you can have it on your person because you may stop to speak to someone. Somebody may be driving by and may stop to speak with you. So you can have your face mask on your person, but you don't need to be jogging on the bypass with your face mask all alone. Thanks.
And that brings us to the last question for today. We want to thank you very much for your questions and hope that they were adequately answered. I would like to thank all those who participated in today's presentations, starting with Mr. Eveling of the St. Kitts and Nevis Building Contractors Association. We also thank Mr. Carlton Phipps, who is Director in the Department of Statistics under the Ministry of Sustainable Development. We also thank Dr. Cameron Wilkinson for reading that powerful testimony from one of our first recovered cases of COVID-19, Mrs. Bernadette Jack, or known as Nurse Jack. We also thank our Chief Medical Officer, Dr. Hazel Laws, for always being here to clarify things, to answer, and to give the report of the situation in St. Kitts and Nevis with respect to the COVID-19 pandemic. Additionally, we thank Mr. Abdius Samuel, who continues to give his report and to ask that people comply with the rules and the regulations so that we may get over this pandemic together. We thank Mrs. Christmas Jacobs for always providing us with sign language, extremely important. And we acknowledge and thank the Honorable Wendy Phipps, Minister of State with responsibility for health. We thank the media who continues to partner with us in this fight against the COVID-19 by providing information that is helpful to the public. We thank Open Interactive, and we thank all of you who continue to tune in each day to get information and to keep abreast of what is happening here in St. Kitts and Nevis with respect to the COVID-19 pandemic. Before I close, I have one announcement that I would like to make, and it has to do with the staff at Rituals Sushi, Albert and Shirley, for their viewership each day of the NEOC daily briefings, and that Sushi is offering 25% discount to all essential workers during this time. Thank you very much, and tomorrow we will be back for another briefing, COVID-19 daily briefing. Until then, take care.
You're in tune to 1FM 98.9. We've come to the end of another COVID daily briefing, and we now bring you the 1FM news and sports.
You found the sound. 98.9. Win FM.
We now bring you the Win FM news. The Win FM News is brought to you by Flow, The Cable, Rams, and SL Hospitals and Company Limited.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Here comes the sun. Sunquick. Here comes the sun. Sunquick. Sunny flavors for everyone. Natural, tasty, full of vitamin C. The drink for the whole family. It's Sunquick.
Sunquick Drink Concentrate gives you 40 glasses. 9 delicious flavors to choose from.
Orange tropical mango.
Peach orange. Orange apricot. Black currant.
Apple. Red orange. Red fruit.
Bursting with vitamin C.
Sunquick.
Natural.